My name is Markita Williams. I'm 19 years old, a soon-to-be sophomore at Central New Mexico Community College, and I'm an advocate for community health charities. And I focus on tobacco use and prevention among youth, and more specifically among African American youth. I started my advocacy when I was 17 years old, which means I've been doing this for about 2 years. And I've done a whole bunch in those 2 years. For example, I created and researched a presentation for youth, and then I was privileged enough to give that presentation not only to the people I started working with, but to other youth groups around the city, like the local BSUs, after-school programs, elementary school kids participating in summer recreational projects and camps, and the University of New Mexico College of Pharmacy students who were really trying to get out there and make a difference. While working with community health charities, I also had the privilege to attend community events and fairs like the New Mexico Black Expo and Juneteenth celebration, where I not only promoted the cessation of tobacco, but I also got to take a look at the African American community around me and figure out new and creative ways to outreach to them and to interact with them. While there, I also helped guide people to the free resources offered by the Department of Health. And as I kind of mentioned as before, I served as a youth advisor to community-based African American networks who are helping smokers kick the habit and help new populations of smokers not start in the first place. And now you're probably wondering why I do this, and I do this for a couple of reasons. One of the number one reasons being that tobacco is the leading preventable cause of death in the African American community, and it kills about 47,000 people a year. That isn't acceptable, and it's not okay, and nor is it cool. I also do it because the tobacco industry has been successful in targeting the Black community, and that's why a larger population of African Americans smoke rather than other populations. And I know that if more people knew that they were being targeted for smoking by these companies, they wouldn't start smoking in the first place. And as a future educator myself, I know that education is key to making healthier decisions and choices. And I was privileged enough to have my work as an advocate featured in a national youth newsletter. And through my work, I've been honored and privileged to meet local leaders such as the mayor, the state attorney general, and a U.S. senator. And it made me realize that my voice and my decisions and my concerns are way more important than I thought. The final reason that I do this is a very personal reason, and that's because I don't want to be another statistic. I don't want people to believe that just because I'm a young lady of color, I should be doing what other young ladies of color are doing, or that they have the right to tell me what a young lady of color should be doing. I was told from a very young age that it's my job to beat statistics, not be a part of them. And I dare anyone out there to help me beat the statistic of not being another young African American young lady who smokes. My name's Markita Williams, and that's my story.